Now, I'm working here from Melbourne with my colleague Bei, who is just up the road in Singapore. Are you there, Bei?
Yes, greetings from Singapore. Good evening.
Welcome, Bei.
We're tag teaming from this other side of the world. We're reporting on basically what happened in Australia, but especially Melbourne, which was the hardest hit part of Australia. And I just very pleased to note that Sue-Ann Harding will be looking at a very important part of the Australian response concerning Indigenous communities. We're looking at CALT communities. CALT in Australia means, what does CALT mean, Bei?
Culturally and linguistically
diverse communities, particularly in Melbourne. And we're looking at the press, very much like our colleagues in Leuven, but we're particularly looking at the relation between the press and ourselves. This is part of a wider project, which is actually finishing up right now. It was focused on 2020. Those are the people in the project. It's cross-faculty. Robin is from health communication. And what we did, we looked at the Chinese, Italian, and Greek communities in Melbourne. We conducted interviews with the community organizations, with the mediators who were going from government releases, press releases, to especially the elderly in these communities. The elderly were the hardest hit and were the most concerned. And we found out were the most at sea, as it were, who had the most difficulty in really understanding and grasping what was going on. Now, the interest of this project for us as translation scholars is that in the press and in the communication and in the interview data that we got, we found a lot of mistrust in translations, as you can see there on that headline. And here we're focusing on particularly the role of trust. This is part of a wider interest for me personally. I see the COVID communication with respect to wearing masks, distancing, and now with vaccines as one example of behavior change communication. For me, it's the same story, the same challenge for the climate emergency. The aim is to use non-coercive means to get a general populace to take action that requires, at some level, trust in something called science. Something called science because, let's face it, we don't really understand it. We have to trust it in order to get behavior to change. So in fact, our trust is not in science as such, but in the people who communicate science to our communities. This is a model to begin with. It's the O-ring or weakest link theory of trust. There is science, which speaks to government, and we hope government trusts some kind of science, and the government formulates policy, which gets out and goes through not only some kind of press or media release. To reach our communities, we pass through translators who are part of that. We get to the organizations that then mediate. They pick up that information and make it understandable to their members. And if you're lucky, we get to behavior change at the end of the line. That's a very simple model of trust. We would assume that failure in any one step may lead the whole lot to fail. And the model is O-ring because it's the name of the gasket that caused part of Apollo 13 to explode. You're only as good as your weakest gasket, perhaps, in this kind of communication. Trust in this model is not to be confused with predictability. It's true that within the communities, particularly the elderly, trusted the people they had known the longest and talked with the longest. And that's a particular kind of trust, but it's not the kind of trust that Luhmann talks about, for example, when he associates it with complexity and risk. Trust reduces complexity. We don't understand the complexity of science, So we choose to trust it to reduce that complexity. But in doing so, we take a risk. There are other people in translation studies who do talk about trust in terms of familiarity. We don't, okay? I'm just situating ourselves within our particular little discipline here. We found earlier on in the piece a previous study out of ANU in Canberra, which shows the degree to which the people they surveyed do trust various sources of information. So scientists, doctors, health experts are at the top. Social media is at the bottom, although 21% do trust social media. So it's not to be excluded from the picture. This is just to situate where our study is. We're looking first at print news or major newspaper outlets like our colleagues in Melbourne. And we're interested in this one, trust local news, trust most news, trust most news organizations. So we're sort of in the middle of that trust range. With that, I hand over to Bei because she's done the hard slog here. She's got all the information.
Okay. Thank you, Anthony. So to investigate the image of translation in COVID-19 news coverage of the traditional and the local news, we conducted this keynote search corpus study by using the ProPress Australian and New Zealand newsstream database. By nature, we consider a reception study, looking at how translation as a product and as a profession has been received by the society through media during Melbourne's lockdown between March to November in 2020. So we use different keyword combination to locate the most relevant news report about translation during the time. After cleaning the data, we have 171 articles remained, but it should be noted that although we think translation is very important, as you can see, translation-related reports only account for a very small portion of COVID-19 news coverage in general. Anthony, can we go to the next page, Anthony? Yes.
Oh, I've got it. Yes, there you go. All right.
Thank you. But the good news is that even though it just accounts for a small portion, we can safely say that the issue of translation has attracted mainstream national media attention, such as the Ages, the Australian, if we look at the top 5 media sources. Yes. What particularly interests us is when and how translation enter into the media spotlight. The line graph shows the number of news articles concerning translation during between March to November last year. The below picture actually shows the COVID-19 cases in Australia during the same period, in which apparently there are 2 waves, one in early March and the other in June and July. Here we would like to explore why translation was not part of the story in the first wave, but become highly reported during the second wave. So here it goes. Anthony. Between March and May, as we can see from the left side of the screen, there is only one visible translator in the media, Stephen Nicholson, who was the sign language interpreter at the Premier's daily coronavirus updates, so people got familiar with him. During the 3 months, there is only one another visible translation scholar, which happens to be our colleague at the University of Melbourne, detailing talking about mistranslation of China's COVID-19 narratives. Apart from these 2, we can see most COVID-19 media narratives about translation and multilingualism were more or less concerned anti-Asian racism. So why the translation was only received sporadic media attention? Because during the first wave, the COVID-19 was caused by overseas travelers bring the infection back when they return back to Australia. But if we look at the right side of the screen, since the late June, things has changed because the second COVID wave actually broke out in Melbourne's Celt community. And the media quickly linked the increase in cases with the government's health communication with these multicultural communities. And the media suspect that health message might not be well understood by these non-English speaking residents. This was also supported by the media's interview with multicultural community leaders. Then both the media and the government realized that the problematic communication was actually caused by language barriers. So to respond to the media's inquiries on 24th of June, the Victoria government argued that health information had been translated into 53 languages. But the media was not satisfied. And the next day, the government admitted that health communication was not as simple as handling written translated materials. This was basically how translation was perceived by the media in June. The impression is that new cases were caused by problematic health communication with multicultural communities, and translation was inadequate. So, can we go to the next page? During the July and August, we see community leaders started to play a more prominent role in the news coverage. On the one hand, community leaders, that is all the three green people, you see, they are actively call for more attention to CALD community. On the other hand, they didn't trust the government's translation, and we see a lot of discourse of complaint. This could be a trust issue, as community leaders share stories about how they themselves translate information to their target readers more directly and more accurately. And they seem to separate professional translation from real cross-cultural communication. As one report on the 10th of June said, we are not simply talking about interpreters and translation of words, but more subtle skills involved in true cross-cultural communication. So in the eyes of the community leaders as translators, we are not doing true cross-cultural communication. Media seems to agree, as journalists suggest that health message have to be delivered by one's peers, I'm quoting what they're saying, and they criticize the government for not making community leaders as interpreters. As a result, or as a response, the government started to provide more financial support to community organizations. So to conclude, the media reports concerning translation in the second wave in Melbourne were highlighting the importance of multicultural communication while somehow criticizing translation profession. Can we go to the next page, Anthony? Yes. So in a few minutes, Anthony will tell us what the implication could be. But at this stage, it is quite clear that in the media's landscape, we have some very visible stakeholders, including the health authorities, the Victoria Multicultural Commission, the journalists, and also community leaders and social organizations. But how about professional translators and interpreters? Who are they? Perhaps they made some translation strategies because of their working conditions, such as not enough time. We don't know. And what kind of production norms might affect their translation strategies? Should translation associations such as NATI or AUSSIE should say something about this? And what would be our ethical responsibility as translation scholars in such a case? And compared to translators, social organizations and CALD community leaders are much better in communicating with media. And they know that they need to have the representation in the media and diverse leadership at the boardroom table. Yes, and they definitely should. Nevertheless, the fact is that during Melbourne's hard time lockdown, there are not only groups who were not unheard or underrepresented. Translators and interpreters, as individuals and as professional communities, are also absent in the media's coverage. So how do we conceptualize this? I will leave this question to Anthony.
Okay, thank you very much, Bei. I jumped ahead there. That's really looking at the main press outlets. If you look, though, at any kind of social media, On the television, on Twitter, everywhere, there were visual representations, as our colleagues in Leuven have pointed out. And the one that was most repeated was this one over here, and the other one was this one over here. And this one concerns some kind of expert complaining about it being nonsensical and the Arabic being nonsensical. And this one over here is easier even because they mixed up Farsi with Arabic. And there was another case where they mixed up Indonesian with Turkish, all right, which is the kind of ultimate insult to the communities with these languages. We care so little about your language, we're going to mix it up with somebody else. Now, these are the images that spread a widespread distrust in translation. But a lot of the problems were not inadequate translators. They were workflow problems. They were bad translation management. There was a failure to test the translations before they got out. Why? Because everybody was going too fast. The result was widespread distrust. And that's the ethical problem that comes to scholars. Distrust in translation is a peculiar thing because the person who needs the translation, by definition, doesn't know what was before the translation. They don't know the other language. And so you are called upon to trust it and take a risk. By the same token, the journalists who were producing this information, reproducing the memes, didn't know the other languages either. In some cases, they did. Generally, though, they didn't. And they turned to experts. We've seen that one expert was there for the case of Arabic. So some of them actually turned to experts like academics, for example, like a professor of translation studies at the University of Melbourne, heaven forbid. And there the ethical problem came out when I was asked to comment on these cases. What do I do? Do I pick it up and say, yes, there are mistakes all over the place? Or do I realize that the public does have to trust translators and interpreters? Do I support the community leaders who have, as Bei has pointed out, were very successful in their interactions with the press in saying the translators are bad, we will do the mediation, we are not professional certified translators, we'll take it over, leave it to us? Or do I do what I'm trained to do, which is train professional translators and support the profession? My initial reaction to that ethical dilemma was this article, which was published through the university and was actually rehashed by no fewer than 4 journalists, one of whom got me to put up the top there are minor mistakes in, oh no, I said there were minor mistakes. I didn't mean to. The article was intended to point out the complexities of translation, the effects of pressure, the inadequacies of the code of ethics that translators work with, which are not adjusted to this kind of situation, and obviously the problem of workflows and people not knowing how to work with translators. No matter, though, once it's in the press and once you put that little phrase up the top, they pick up what they want. And so my adventures into the land of journalists goes through these particular things, starting from that article, reprinted, radio, pressed. I got on the television. Oh, that was horrible. And interviews cited. I'm in it. I mean, everybody else here has had sort of the great luxury of looking at it from the outside and presuming that the humanities will be important for policy decisions. I didn't have time for that kind of reflection. I was sort of thrust into it. And other colleagues more than myself. I won't pretend I'm the only one there. But you see, there it is. It was a mess, Pym said. No, Pym never said it was a mess. I was talking about the practical problems of doing translations under pressure. But the discourse of journalism needs focus. needs scandal. It needs to produce what is new. And here again, I turn to Luhmann. The system of the mass media doesn't concern what is true in terms of any other system, the system of translation, for example, or of science, for another example. Its function is to produce what is new. And I found myself as the completely naive academic whose words were misconstrued repeatedly in service of a scandal. Now, here's what happened. Distrust of translators was thereby circulated throughout the media, trust was eroded, and cooperative behavior was made more difficult in these communities. But thanks to the press, thanks to the simulacra of bad translations, money came to support translations. And that money went to certainly translator and interpreter services, but also the community organizations who knew how to interact with the press much better, and the distribution of translations, which was the real problem. So there's a sting in the tail. You thought I was going to complain about journalists. No, not at all. I recognize that academics like myself, we are really bad at this, and that the important behavior change, the change in the attitude of the government, which recognized that it was using the wrong media, that it had to interact with the community organizations, as you can see in the distribution of money there, that behavior change came thanks to the journalists. But there's a sting in the sting of the tail, because this new program, which we have now, using all that money that came in from the government, some of that money comes back to us as a research group. And we have now a new project to judge how well the government has spent that money. I'm going to finish there because that's time, but I'd be really, really happy to hear from anybody else who has faced the same kind of ethical predicament as I personally have and as our research group has in the previous or the past few months. Thank you very much for your time.